Welcome to Advanced Dual Health and Life Coach Certification. Today we're going to review ethical considerations and professional standards, specifically avoiding misrepresentation of qualifications or skills. Let's start with an introduction. The field of coaching thrives on trust, integrity, and clarity. Life and health coaching in particular is a deeply personal process that depends on a client's confidence in their coach's abilities and knowledge. However, with coaching becoming increasingly popular and accessible, cases of misrepresented qualifications, exaggerated skill sets, and overstated results have also grown. Misrepresentation in the context doesn't simply harm the professional reputation of an individual coach. It jeopardizes the entire coaching profession's credibility and can lead to severe consequences for clients' well-being. Here are some key points. Defining misrepresentation and why it's harmful. What is misrepresentation? Misrepresentation involves providing false, exaggerated, or incomplete information regarding a coach's certification, training, skill set, or expertise. This can range from listing unearned certificates to claiming expertise in a niche coaching area without adequate experience. Here's some examples. Claiming your coaching services can treat mental health disorders without being a licensed therapist. Listing a certification on your website that was not completed. And using a misleading job title such as licensed health coach in a jurisdiction where no licensure exists for that role. Consequences: legal risks, loss of trust, impact on clients. Review each. Why integrity matters. Coaching is a client-centered field. Misrepresentation leads to disservice and unethical practices. How to accurately represent qualifications. Number 1, be clear about certifications. Always specify the certification, completed, and the certifying bodies. For example, instead of saying, I am a certified life coach, clarify by listing certified through XYZ institution in cognitive behavioral coaching. Never use ambiguous language. Avoid phrases like specialized in all areas of health coaching unless there's a formal training proof. Vague descriptions can mislead clients to assume a skill set you might not actually possess. Example of proper representation. A health coach may have attended short workshops on nutritional counseling but lacks formal licensure as a dietitian. The proper representation would be, I offer general guidance on nutrition based on workshops completed through accredited programs. For medical and clinical nutrition advice, I collaborate with licensed dietitians. And check with governing bodies. Terms such as certified, accredited, or licensed often have legal protections. Understanding regional regulations ensures you use these terms truthfully. Take a look at the model qualification method diagram on the right. Identifying and communicating your scope of practice. What is the scope of practice? This defines the roles, responsibilities, and boundaries that align with the coach's formal training and qualifications. Example 1. A life coach focuses on setting personal and career goals, not diagnosing mental illnesses or prescribing medication. Example 2. A health coach helps with general strategies for healthier eating, but refers specific clinical diet needs to registered dietitians. How misleading scope harms clients. If a coach steps out of their scope, they risk providing ineffective solutions, worsening client problems, or overlooking crucial issues requiring specialized care. Practical ways to stay within scope. Add disclaimers to service descriptions. For instance, this program is educational and not intended to replace advice from a licensed medical professional. And use specific language during sessions to clarify roles, such as my role isn't to prescribe programs, but to guide you in building sustainable habits. Number 4, the role of transparency in marketing materials. Assess marketing messages. Coaches often unintentionally mislead through overly ambitious claims in advertisements or client testimonials. It's vital to ensure that every statement in your marketing materials reflects genuine outcomes and expertise. Common pitfalls. Claiming to guarantee success, ignoring the variability of client efforts and circumstances. And post uncontextualized quotes like, this coach changed my life in one session, can create undue client expectations. Recommended practices: use measurable results. For instance, instead of saying, I transform lives, try 70% of my clients report achieving personal goals within 6 months of coaching. Make qualifications visible so clients know what credentials back your services. And include clear boundaries. Example disclaimers for health coaches. All advice given is intended for educational purposes and not as a replacement for professional medical advice. Building a culture of accountability. Seek professional supervision or peer review. Regular feedback from peers or mentors can ensure your qualifications are properly represented. And attend continuing education programs. Ethical marketing and professional representation are often covered on ongoing training programs through the ICF. Examples of actionable steps: schedule annual certification audits to ensure all courses and qualifications are current. Implement client feedback mechanisms to assess whether they perceive accuracy in how you present your skills. Ethical guidelines and industry standards. Understand industry ethics. Leading organizations such as the ICF or the NBHWC outline ethical codes requiring honest communication of qualifications. Coaches should familiarize themselves with these and integrate them into your practice. Example ethical standard. The ICF Code of Ethics requires coaches to clearly explain and accurately represent their own qualifications, including levels of coaching certification, education, and experience. Examples of misrepresentation, avoidance, and action. Scenario 1. A health coach with a leadership background claims corporate expertise. Application: explicitly state, my background includes leadership roles in healthcare teams, providing foundational insights into team coaching for productivity. Scenario 2. A life coach wants to attract mental health focused clients despite not being a therapist. Solution: reframe their services to avoid overlap in therapy. Best practices for coaches. Adopting best practices ensures coaches represent their skills ethically. This section outlines specific practices, examples, and actionable tips to help coaches avoid misrepresentation while reinforcing their professional values. Number 1. Accurately communicate certifications and training. The best practice: always list competent and completed certifications, training programs, and accredited institutions. Avoid implying credentials that are incomplete or unearned. For example, instead of saying certified in holistic nutrition, use completed holistic nutrition fundamental certification through XYZ institution in 2022. Action tip: periodically review your professional profiles, your website, your social media, and directories to ensure all credentials are up to date and reflect current achievements. Define and adhere to your scope of practice. The best practice: understand and articulate the boundaries of your capabilities based on training. Avoid offering advice or services outside of the scope of your coaching. For example, a health coach might say, I don't diagnose or treat illness, but I can help you build an exercise habits that aligns with your doctor's recommendations. Action tip: include a disclaimer in client agreements or marketing materials. Practice transparency in marketing and client communication. The best practice is to set realistic client expectations by avoiding exaggeration. Instead of advertising guaranteed weight loss, clients who engage in my 12-week program typically see XYZ results. Regularly review promotional materials with a mentor or colleague, and regularly seek feedback and supervision. The best practice: engage peers or mentors to provide accountability and help identify potential misrepresentations in marketing or client communication. For example, a mentor may recommend changes to vague language like expert in all areas of coaching to more specific descriptors of expertise. The action tip: schedule periodic peer reviews of online presence, and pursue continuing education on ethics and compliance. For example, enroll in a yearly webinar on adhering ICF ethical guidelines. Dedicate at least 10% of your annual professional development time to topics related to ethics, scope, and representation. And collaborate with other professionals. The best practice: building a network of allied professionals. If you're working with a client facing trauma-related challenges, refer them to a trauma-trained therapist while continuing to provide goal-oriented coaching support. Action tip: create a referral document with contact information from trusted professionals in related fields. And use clear and specific language. The best practice: replace vague or grandiose terms with precise language that accurately reflects your coaching focus and expertise. Avoid I can help you with anything, and instead to I specialize in habit formation. Incorporate ethical standards into practice. The best practice: adhere to ethical guidelines outlined by recognized associations and organizations like the ICF and the NBHWC. Display a summary of the relevant ethical codes in your office or share it with clients during onboarding. And provide evidence-based testimonials. The best practice: when sharing client success stories, obtain consent and contextualize results to avoid creating false expectations. Client X achieved significant progress during weekly accountability coaching alongside their physician's guidance. Action tip, use client surveys to collect honest feedback and consistently assess the impact of the coaching programs. Address missteps proactively. The best practice, if discrepancies in your qualifications are pointed out, address them immediately and record and correct the record. If you mistakenly advertise training you haven't completed, issue a correction and apologize. Keep an updated record of all certifications, courses, and licenses for each reference when drafting promotional materials. Final thoughts. Avoid misrepresentation of qualifications or skills, and it's not just about avoiding potential pitfalls, it's about creating an authentic practice that establishes trust, builds credibility, and prioritizes client well-being. By presenting yourself honestly as a coach, setting boundaries, and regarding your scope, and committing to transparency in communication, you cultivate lasting success and ensure your coach's practice stands out ethically and professionally. Here are some summary tables for your review. Table 1. Here you will see the aspect, the description, examples, consequences, and how to avoid. Take a look at each aspect. Table 2. Best practices for representing qualifications. Here you'll see the practice, the details, why it matters, the example, and the outcome. Walk through each practice. Clarify certifications. Define scope of practice. Avoid overpromising. Use clear language, and seek peer reviews. Table 3. Steps to stay within scope of practice. Review each step, description, why it's important, the example, and the result. Here's a review of the steps. Evaluate your role, add disclaimers to services, collaborate with experts, use specific client language, and stay updated on regulations. Table 4. Components of ethical compliance and misrepresentation. Table 4. Components of ethical compliance and representation. Here you'll see the component, the explanation, the importance, the example, and the outcome. Take a few moments to review each component. Honesty in communication, transparency in marketing, disclosure of limitations, adhering to ethical codes, and continuous ethical training. Table 5. Comparing proper versus improper representation approaches. On this table, you'll see each aspect, the certification listing, the marketing claims, scope of practice, language transparency, and feedback integration. Take a few moments to review the rest of Table 5. Here are some multiple choice questions for your review. Question 1. Which of the following best practices Question 1. Which of the following best describes misrepresentation in the coaching profession? Review options A through D. The correct answer is B. Question 2. What is one of the most effective ways to avoid misrepresentation when Review options A through D. The correct answer is D. Using accurate language that reflects your true qualifications and skills. Question 3. Which statement aligns best with the principle of adhering to scope and practice as a coach? The correct answer is C. Question 4. Why is it important to clearly communicate the certifications you have completed? Correct answer is B. To build trust and maintain credibility with clients. And question 5. What is an example of ethical marketing practices in coaching? The correct answer is B. Creating disclaimers to clarify the educational purposes of your coaching programs.